Hi, I'm Dr. Ford, and today we're doing a 5-minute brain workout on the signs of pregnancy. One of the most popular Google searches is about signs of pregnancy, like, I'm 2 days late and I feel fatigued, am I pregnant? Google can certainly validate the perceptions of a woman, but she'll have to wait a little longer before she gets a more objective sign of pregnancy. The signs of pregnancy are separated into 3 categories. Number 1, subjective or presumptive signs are what the mother-to-be perceives. Number 2, objective or probable signs are those detected by a test or any kind of physical examination by the healthcare provider. And number 3, positive signs. Positive signs are objective confirmations by the healthcare that a fetus is growing in the uterus. So those are the 3 categories of the signs of pregnancy, but let's talk some details. The presumptive signs of pregnancy are really the least reliable sign of pregnancy, but they're still really important because those subjective presumptive signs can notify the woman, hey, something's different, you better check it out. Like, for example, being a few days late for a period if her cycle is normally very regular. So fatigue, breast tenderness, nausea and vomiting, heading to the bathroom every hour, all of those are presumptive signs and they're all subjective. And they happen if they happen, they're going to be usually in the first trimester and usually in the very early weeks of pregnancy. Subjective signs that happen toward the end of the first trimester are breast enlargement, uterine enlargement, and around 16 to 20 weeks, that physical sensation that something's moving around in there, and that's called quickening. So now some objective signs. The number 1 objective sign of a probable pregnancy is the pregnancy test. So the over-the-counter home pregnancy test that everyone can buy is exactly the same as the healthcare provider's urine test. So the test detects the presence of human chorionic gonadotropin, which is HCG. It detects it in the urine stream as early as 8 days after conception. HCG is the earliest biochemical marker for pregnancy. However, a more precise unit of measurement is going to be done through a blood test, and that would be done by a healthcare provider. And so this blood test measures the exact amount of HCG in a woman's blood, and so it's done by measuring a beta subunit of HCG. Other physical signs that are probable signs of pregnancy that can be detected by the healthcare provider are things like Goodell's sign, that's softening of the cervix, Chadwick's sign, that's when the cervix turns like a bluish purple color instead of pink. Hagar's sign is the softening of the lower uterine segment, and ballottement, that's when the healthcare provider pushes on the cervix during an exam and can feel the rebound of the fetus. So finally, let's talk about positive signs of pregnancy. Positive signs of pregnancy are when the healthcare provider can confirm without a doubt that there is indeed a fetus growing inside the uterus. An ultrasound can verify the presence of an embryo or fetus, sometimes as early as 4 to 6 weeks. Fetal heart tones are also a positive sign of pregnancy, and they can be heard by a Doppler, usually around 10 to 12 weeks. And some very experienced clinicians can actually feel fetal movement during a physical exam of the mom's uterus, and sometimes that happens around 20 weeks. So that would also be a positive sign of pregnancy, proving that there is a fetus in the uterus. Okay, it's been almost 5 minutes, and we've talked about the 3 categories of the signs of pregnancy. Subjective signs presume pregnancy, objective signs indicate probable signs, but positive signs are what really confirm pregnancy. So in closing, I want to ask you why. Why don't those subjective and objective signs confirm the pregnancy without a doubt? What else could be going on other than a pregnancy that could cause similar subjective and objective signs? I'll leave you with that question. I'm Dr. Ford, and you just completed a 5-minute brain workout on the signs of pregnancy.